Eldred, Alicia, and Teresa, welcome to New Mexico in Focus.
Thank you for having us.
And Teresa, Honoring Native Life and Indian Affairs has been hosting virtual trainings. What are some of the things that you've been hearing about mental health in tribal communities during the pandemic?
We've actually been hearing a lot and really appreciative of the collaboration with New Mexico Indian Affairs. We know that the pandemic has disproportionately affected American Indians and our tribal nations. And so we've been working very closely to ensure that we're doing the training that's necessary and putting out messaging to help our tribal communities through this pandemic. But we do hear about a lot of increased anxiety, increased depression, some spikes in suicide rates that we're hearing about. So we're trying to address many of those issues.
And Eldred, anything to add to that?
Yeah, I think just all of us, from a personal standpoint to professional standpoint, we feel, this absence of community, this absence of really coming together as tribal peoples. And I think that really has kept a lot of us in isolation, has led to increases in what Teresa just mentioned, a lot of those mental health challenges. And really from tribal perspective, tribal leadership to tribal youth, we've been hearing this, the need for more behavioral and mental health resources and services on and off tribal reservations. And so the Indian Affairs Department is just so happy to collaborate with not only Honoring Native Life, but also our newly established Indigenous Youth Council.
And what are some of those challenges? Can you expand on that a little bit? We know in rural areas, there's lack of internet service. There's also access to, or lack of access to healthcare. There's even a lot of different issues when it comes to addressing mental health itself. So what are some of those challenges?
Yes, so one of the major challenges was, of course, the limited access to broadband capabilities. So when the world was closing down, when New Mexico was closing, a lot of our tribal communities, everything was moving towards telehealth. And a lot of our tribal communities, some of the most rural, did not have those capacities, capabilities, even to today. There's been a lot of progress, definitely from the state of New Mexico to help that. But that's really what happened. And even prior to the pandemic itself, tribal communities had very limited amount of behavioral health providers, whether that be counselors, therapists, psychiatrists, et cetera. And so really what the Indian Affairs Department here is doing now is really to focus on that community input to figure out many of those challenges. Additionally to those broadband challenges, you also have stigma within tribal communities, but in just general about mental health and behavioral health, and trying to just destigmatize the whole notion that you can ask for help.
And Alicia, with the Youth Council, one of the recommendations to the state was the need to address mental health among young people across New Mexico. Talk a little bit about why the Youth Council sees this as a big need.
Yes, so in the conversations we've had with our tribal youth in New Mexico, we certainly saw the priority to increase mental health wellness. We've seen with the closure of things across the state and as well as within our own communities, I believe like the absence of ceremony has also been a damper within our communities. And, although we still maintain our spiritual connection, that was one of the main ways to practice. And so we discussed, how the pandemic has taken a toll on youth, primarily, especially with, as Eldred mentioned, the move to telecommunications, especially in the terms of education. And so seeing how our youth have been moved online and, a lot of the experiences that they've had or expressed was that, there's a lot of responsibilities when staying at home, taking care of older family members or even younger siblings and other relatives. And we wanted to make sure that we provided that space for support for them and to ensure that they are, feeling like they have resources to look to. And, although, this year has been very challenging for our communities, we feel that it's important to recognize that spirit of resiliency and community for our young people. And so that's why we banded together as the Indigenous Youth Council with the New Mexico State Indian Affairs Department to help create spaces for that.
And Teresa, it was mentioned earlier a little bit about the stigma surrounding talking about these issues, even they're just tough topics to talk about, or if it's any kind of taboo, and how mistrust of maybe even getting professional help. Expand on how culturally sensitive topics like this are addressed through honoring Native life.
Well, and thank you for the question. And honoring Native life was born out of a state legislatively created clearinghouse for Native American suicide prevention, and that was enacted in 2011. And it was really an effort from the Indian Affairs Department and the Behavioral Health Collaborative that came together to address suicide clusters in several tribal communities. And it really was created with the intent to provide culturally relevant, culturally appropriate suicide prevention efforts. Soon after the legislation was enacted, the founding group came together, and we talked about the name Suicide Prevention Clearinghouse, and that's how Honoring Native Life was born out of that. Rather than focusing on the suicide, that we would focus on some positive aspects, and at the same time ensure that we were engaging in suicide prevention strategies.
And so how can people approach talking about mental health, well-being, and being culturally sensitive, either if it's for them, for them personally, or for maybe friends or family members?
Yes, I think society in general needs to talk about mental health in a different way. When we think about physical health, we think about someone diagnosed with cancer, or maybe somebody has a broken leg. We tend to lean into attending to those individuals' needs. But when we're talking about mental health and mental illness is just like a physical illness. It's a brain disorder in some cases. It's a number of things, but we don't talk about physical health and mental health in the same way. We also know that by not talking about it, I know in a lot of tribal communities, the issue is taboo, but even if we don't talk about it, it's still occurring. We still see high rates of anxiety, depression, and we know that for American Indians across the country, that suicide is exacerbating. And so we need to be talking about this, and we need to remember that mental health is health, and it's not separate. It's not separate from our whole being.
And Eldred, Alicia talked a little bit about youth and how the pandemic is impacting youth. Elders are also a really key part of tribal communities across the state. How are tribes and how is this Indian Affairs Department helping ensure that elders are also being taken care of?
Yeah, thank you for that question. So with the Indian Affairs Department at the moment, we're actually leading 1 week out of the state's mental health awareness month. And so every week there's a theme, and this week is elders and tribal communities. So not just elders and tribal communities, but elders across our state to honor their resilience as well as their leadership. And so in the New Mexico Indian Affairs Department, we understand and know that mental health, behavioral health, it's holistic, but also intergenerational. And so the work that we do with our youth, it'll really connect and hopefully be that catalyst to tackle community wellness, or in the sense of ameliorate the community wellness in our tribal communities. So with that, we also partner with our state agency, Aging and Long-Term Services Department. to be able to provide those resources continually to our eldest and most respected members of our communities.
And what kind of resources is the Indian Affairs Department looking for mental health and behavioral health issues from the state of New Mexico?
Yeah, great question. So for the Indian Affairs Department, we're really rooted in community input. We're learning more and more how pivotal our position is as a department within the state's overall behavioral health ecosystem. And so one of the arms that we do have within the department is to work with the Native American Subcommittee, which brings together all different types, all communities within New Mexico, all tribal nations. And those resources that we do provide, and not only to provide them community, but also to get that feedback into what they're moving forward. Some of the ideas that we have on the forefront, in addition to this Youth Wellness Summit, are to look at broadband capabilities, how to better that, how to bolster our behavioral health providers within our tribal communities, other resources in terms of healthcare lines or mental health helplines, such as warm lines or hotlines. In addition to that as well, just getting out materials. During the COVID-19 pandemic, we partnered with the Human Services Department and within their Behavioral Health Services Division with artist Ricardo Cate from Kiwa Pueblo, and we were able to put out a youth mental health COVID-19 coloring book. And so from there, it was really to help the youth be able to connect with their family members, all the way from parents to grandparents, and talk about some of these difficulties that we're facing at this time.
And Alicia, there's a Tribal Youth Wellness Summit in June. Indigenous knowledge is going to be focused on for healing and responding to COVID-19. And talk a little bit about why Indigenous knowledge is such a key, important part of tribal communities.
Yes, so in terms of, Indigenous knowledge being integral to the focus of this Youth Wellness Summit, we feel that, health, as Teresa has explained, is, multi-level. It encompasses physical, emotional, mental, and spiritual well-being. And so within that, it's, it contains all of these. And so we want to make sure that we're following what we know to be true in our communities of, being holistic. And, within that, it's collaborating with so many different resources amongst the state, especially utilizing Honoring Native Life's platform and their knowledge to help contribute to that. And also, maintaining that cultural respect for all of our communities.
And Teresa, where can people go, or how can they find information? What do they do if they think they're in need of some resources?
There's quite a few crisis and access lines that are available, text lines, crisis text lines. And I just heard of a new initiative coming out of Northwest Portland area Indian Health Board, where individuals can try text 741-741, and within that text write the word Native, and then can be connected with someone who's familiar with tribal nations and responding to those crises. But there's quite a few text lines and phone lines that people can call to get help, especially if they're in crisis or if they just need someone to talk to.
Well, thank you all so much for joining us here today on New Mexico PBS, Eldred, Alicia, and Teresa.
Thank you so much.
Thank you.